Dr. Shraddha, Kriya, please share live link from YouTube. Can I? Dr. Deepali, can I start?
Just give me 5 minutes. There is some technical issue. I'm solving that.
YouTube streaming start हुआ है. Please forward link in group only. Everyone, please forward link in WhatsApp group.
Yes, you can start now.
Okay. Good evening, everyone. Good evening, everyone. I'm Dr. Sayyid Nizam Ali, founder of Zenith Ayurveda and co-founder of Ayush Gurukulam. On behalf of our team, I warm welcome to all for today's session. Ayush Gurukulam is an initiative by PG scholar and BMS student to spread Ayurveda with respected to our teacher and traditional. Along with this, Zenith Ayurveda works to the create education content to the awareness about Ayurveda. Our aim is simple to connect traditional wisdom with modern learning to make Ayurveda accessible for everyone. That why we can started this knowledge sharing session. जैसे कहा गया है आपने आयुर्वेद को नहीं बल्कि आयुर्वेद ने आपको चुना है वी थैंक ऑल ओवर द मेंटर एंड प्रैक्टिशनर फॉर दिस सपोर्ट with this I hand over the session to Dr. Meghna. Thank you. Dr. Meghna.
Good evening to all the earnest Vaidyas gathered with us today. I'm Dr. Meghna Kulkarni, representing the viral Instagram page Just GMC Things. It's my privilege to introduce to a distinguished personality in the field of Ayurveda, a scholar, teacher, researcher, surgeon, and kind-hearted Dr. Siddanagouda A. Patil, sir. Dr. Siddanagouda A. Patil sir has begun his academic journey with the BAMS from the prestigious Ayurveda Mahavidyalaya Hubballi, followed by MS-IU in Shalyatantra from the prestigious STM College of Ayurveda Hassan. Sir then went on to create history as the first ever Ph.D. award in Shalyatantra under RGUHS Bangalore, under the guidance of renowned Dr. Prasanna Narasimha Rao sir. His research contribution includes significant works on management of futures and bone healing, with the dissertations that continue to inspire modern Ayurvedic surgical practice. With an impressive 20 years of teaching and clinical experience, Dr. Patil sir is currently professor in the Department of Shalyatantra, Ayurveda Mahavidyalaya, Hubballi. He is also a recognized guide for PG and PhD scholars, shaping the next generation of Ayurvedic surgeons. Dr. Patil sir's career reflects the extraordinary balances of academic brilliance, surgical expertise, and social commitment. Sir has operated more than 15,000 anorectal cases and has mastered parasurgical procedures like Kshara Sutra, Agnikarma, and Raktamokshana, along with modern interventions such as fracture management, rhinoplasty and lobuloplasty, and rectal prolapse surgeries. Sir has made remarkable academic contributions with over 30 publications, 16 paper presentations, and 12 national and international seminars organized besides guiding 21 PhD and 12 PG students. His organizing skills are evident from his role in events like Yoga and Yoga Sutra, Kaushalya Bharati, and Yoga Chintana, where he has successfully blended traditional wisdom with the modern surgical insights. Beyond academic, Dr. Patil sir has been true servant of society, conducting over 300 free medical camps, delivering awareness lectures for workers, drivers, and general public, and playing a frontline role during the COVID-19 by establishing a COVID care center at Hubballi and offering free telemedicine consultations. His service extended to social cause like health education, Swachh Bharata drives, flood relief, in distribution of essential kits to the underprivileged. Sir dedicated efforts have earned him prestigious honors, including the Basavarashtriya Prashasti in 2013, Seva Ratna in 2021, Adhyapaka Bhushana in 2023, and Dhimanta Nagarika Prashasti in 2024 by Hubballi Dharwad Municipal Corporation. Today, we are honored to welcome a visionary academician, an inspiring surgeon, a gentle social worker, an award winner teacher whose life is testimony of service, dedication, and excellence, Dr. S. A. Patil sir. I request Dr. S. A. Patil sir to please take over the session and share his valuable clinical insights and expertise with us. Over to you, sir.
Okay. Namaste to all. Thank you, Dr. Mega, for an wonderful introduction and other things. And Dr. Nizam, the founder Zenith Ayurveda and Ayush Gurukulam, and all the respected audience who have online today. And it's my privilege that I need to address you all and share whatever experience I have in the field of proctology. I try my level best to present within proctological disorders today. Thank you once again, Dr. Megha and the team Gurukulam and Zenith, Dr. Nijam, and all the respected audience. So, share Martin. Dr. Nijam, now it is screen is
Yes, sir.
visible.
Visible.
Yeah. Shall I proceed now?
Yes, sir.
Yeah. So, being most demand and there is a need, and because of the lifestyle which is going high with the modern thing, whatever is available in the market, whatever we are doing, that's all is causing trouble directly to the costa or disturbs the agni, and ultimately end result with the disorder called as most important of what I am doing presently. It is a bread and butter for us is anorectal disorders. So we thought of when Dr. Nijam asked about this, so we thought of presenting the parasurgical procedures, its role in anorectal disorders, which we come across commonly. So I thought of doing it and we are doing it. So before going, we all are Ayurveda doctors. Our main aim is to Swastasya Swastha Rakshanam. Along with the important second aim is Aturasya Vikara Prashamanam. So if you are doing Aturasya Vikara Prashamana honestly and ethically, definitely what we have studied, we have to practice. That plays an important role, and also it gives an satisfaction for us also. I being the Shalyatantrajna, if I take a word from the definition of Shalyatantra, he said the importance of Shastra, Kshara, Agni, Pranidhana. All these things which play an important role in the management of Gudagata Vikaras. Then, after knowing this, what is the importance of Guta? It is one of the Dasha Pranayatana. There is a Pranaha Tishtanti. If I quote an example, if a patient comes with an history of pain in the anal region, if you suddenly, without explaining anything, without lubricating, if you do it suddenly per rectal examination, patient will shout or he may die. So, because of this, there is a Pranaha Tishtanti which definitely disturbs and may cause a death. This is one vasovagal attack in the patient. So it is an alarming thing to do. Before doing the proctological examination, you should explain, convince, and lubricate. Then you do the procedure. So it is one of the karmendriya, vairmukha srotas, and sadhya pranahara marma. That's what I highlighted till now. So it is also a Ashtamahagada. There are various disorders difficult to manage, which has a vast etiological things, and even after treatment there is recurrence. Because of that, most of the diseases they listed in the disease called as an Ashtamahagada, Arsha, Bhagandara, and all these things. So this Arsha, what we are going to deal today, the anorectal disorder, predominant disorder, is also a Ashtamahagada. Before knowing the Guda, we should know the anatomy of the anal canal. It is a terminal part of the large intestine and begins at the anorectal junction 2 to 3 centimeter and front just below the tip of the coccyx. If you appreciate it, you can see the diagram here in this diagram. And it is a downward and backward once you see, and opens at the anal orifice about 4 centimeter and offers a tip at the coccyx. The length is approximately 3.8 or 4 centimeter in length. So important thing is arterial and venous drainage. The very important thing is a superior rectal artery. Another important middle and internal iliac artery. Another important inferior rectal artery. The same thing with the important is inferior mesenteric vein. It is drained from the periphery. Another thing, it drains into the internal iliac vein. The same thing it is with the pudendal vein, which drains. Why it is important is whenever we see the examination, will comes an importance of this arterial and venous system. What are the connection and precautions? There are various structures which are related to this. Is what is highlighted in the diagram can show you. So another important thing, interior of the anal canal is very important. Only about 3.8 centimeter or 4. It is divided into upper and lower zone. Divided into 3 parts like upper, middle, and lower. the upper one-third portion, which is the having the differentiation line called as a pectinate or dentate line. This plays a very important role that above this, there is a columns of Morgagni. What is this columns of Morgagni? These are the mucosal folds which folds with the downwards and forms the acini here at the base and the columns. In between, there is a gap. The acini which gets infected, they may cause an abscess, they may turn into an fistulae. These columns of Morgagni, just above here, this is the area of hemorrhoids which we commonly. Whatever hemorrhoids occurs here, the painless because it is an empathetic supply. The lower this is a somatic one, the very painful one. So whatever bleeding occurs with the painful may associated with the fissures because of this sensory nerve supply, what we call it is. So here you can understand inferior rectal or a somatic nerve, which is a branch of the pudendal, starts with the S2 to S4. This is very important, two branches, autonomic nervous supply, that is above, lower is the inferior rectal, that is somatic. So if the hemorrhoid is there, it is not a painful. If the associated with the fissure, because of the somatic nerve supply, it is a very painful. So we must understand this prior to this one. So very important thing is anal cushions. These are the vascular portions which you can see in the diagram on either side. This is the capillaries, veins, venules and all these together. The protrude and mass like structure is appreciated. It is called as a cushions you come across. So then what are the disorders, Gudagata Vikara or the benign anorectal disorders? Very commonly we can come across the Arsha. You can see here external, Arsha internal, protruding 3-7-11, and it is in thrombosed hemorrhoids, the fistulae and the fissure here, and the prolapse rectum, the prolapse unibronchia or uterine prolapse or pilonidal sinus. These are the various benign disorders. This is very commonly we come across in the day-to-day practice. So coming to the one among the anorectal disorders is Arsha. We are looking into the either side. The definition goes Arivat Pranan Sunati. It is a very painful if it is associated with the other things like hemorrhoid or thrombosed or inflamed or associated with the other disease. That's what he says, Arivat Pranan Sunati. Very painful. Or even it takes a life by causing the bleeding. It is a mass which obstruct the Guda Marga like an enemy. Acharyas also, they say Ankuras or Valis are called, they are very important thing where you can disturb the causing the disease. For this disease, there are various synonyms has been given like Durnama, Gudakila, Anamaka, Gudankura, Mamsakila. These were the various synonyms based on the appearance. So Arsha vis-a-vis can be compared with the hemorrhoids. The word hemorrhoids is a Greek term. He means blood, road is a flow. The same thing in the Latin, it is called as a pila, a ball-like structure. What is told in the definition, the Ankuravat, that is a ball-like in the anal Gudabhaga. That is very commonly. It is a symptomatic enlargement or a distal displacement of the anal cushion is known as a hemorrhoids. These were the piles or hemorrhoids or the swollen veins in the lower rectum and the anal canal. Either may be internal or maybe an external. It is with the both medicine and surgery. That's what Acharya in the context of management, he says, Beshaja. So it is one of the important branch where you can even the medicine also plays an important role if it is an early diagnosis. If it is goes higher level, if it is a longer duration protruding out, then it comes to the area of surgery, what we routinely do it. It is the most commonest condition affecting the both sexes caused by the increased pressure. You may not believe that by seeing these articles which I collected one article, there is because of this problem, piles, person has attempted for suicide. Person may because of this, he has using the ring which can be used for the reduction of the pain and other things. Some person may use the tying over the twigs of these trees. That is also one important. The folklore practice, they highlight all these things. We should be aware of all these things for that reason. Another important story, what I can tell is even the famous ruler, French military general, that is Napoleon Bonaparte, who suffered from piles. When he suffered with the piles, he can't able to go for the battle. So because of that, he lost the battle of Waterloo. This is one information. Another incident, once you take out the incidents of this one, 50% of the population will experience symptoms of hemorrhoids by the age of 50. Every human being, because of this present lifestyle and the food habits, one or the other day, he will suffer with this problem. This is what the present statistics says. So only there is one day is dedicated for the same hemorrhoid, or a World Piles Day is celebrated as on the every year November 20th. We are celebrating in terms of creating an awareness to in the society that you should not take such food habits. You change the lifestyle and change the food habits so that you will not be suffering with this one. And is like Napoleon, how he suffered and lost, so that individual should not suffer and lose his economical status and other things also. So what are the nidanas for this is, what he says is anatmotam, and also very important viruddha atyasana stri prasanga utkutasana prushtayana vegadarana udirana, all these. So presently, earlier there was an important thing, prushtayana. Presently also vehicle riding is a very much important thing. And utkutasana, we can see here utkutasana is a very important thing. Another one important by vegadharana, sitting for constant fitting for long duration, and viruddha adhyasana, all these things which may definitely cause the drinks which are present with the citrated drinks, which also disturbs the agni and causing the trouble, and all these things will definitely lead into a manifestation of the disease. If you go for the same with the hemorrhoid, the etiology is hereditary. How hereditary will plays? Whenever patient comes, anybody into your family, grandmother, father, mother, anybody suffered? Yes, they says yes. 3 generations I'm having the patients of 3 generations also, now also, because the hereditary will play an important role. What is that? There is a genetic change which can lead into the change in the vasculature of the veins at the anal canal, which leads into the protruding out. This is the one reason that is a hereditary causes. And the same thing, Sahaja Arsha, what we can call, this is one example as an hereditary. The another important acquired is lifestyle factors like diet. There is a low fiber diet, the definitely lead into a hard stool. Hard stool will definitely put some pressure, and the protrusion of the masses will be very common. The sedentary lifestyle will also be one of the another important and foremost etiology for the hemorrhoid. Then another reason, obesity, like other increased intra-abdominal pressure may be a pathological or physiological. Physiological very commonly come across in case of pregnancy. The other thing, pathological, like chronic constipation or straining during defecation due to constipation, either it may be a primary cause or a secondary causes. And a chronic cough, ascites, weightlifting, all these things are contributing for the increased abdominal pressure. There's some conditions like infections which may either directly trauma or anything which is related to that one. Or venous obstruction, the most important is the portal hypertension is also one should be think of all these things. The age-related changes, the degeneration supporting tissues in the anal canal, the prolapsing tendency of the masses will be very commonly seen. The occupational factors like sitting or standing for longer duration. A clerical job, or a soldiers, or a watchman, or other home guards, all these persons, policemen, conductors, drivers, all these persons will come into this area where the occupational hazards, occupational factors, which can directly influence. Along with these etiology, if they consume either alcohol or tobacco or other thing, definitely it can influence on the particular tissue. There is a muscular tissue that nicotine and other things will reduce the elasticity and the protruding out. This may be the few of the articles which are suggested. The other things like anal hypertonia or aging or intra-abdominal pathologies or malignancy or other pathologies can also result into the protruding out, like irritable bowel syndrome, like ulcerative colitis, which also end result of these conditions very commonly we come across as one of the other secondary causes. Once we know the etiology and definition and all those things, we need to understand what are the different types like based on the classifications. Only important thing is two main classifications like highlighted internal hemorrhoids or external hemorrhoids. Internal hemorrhoids are above the dentate line which covered by a mucosa, and external hemorrhoid below the dentate line covered by a enoderm which you can able to see. By this proctoscope middle picture which shows about the internal hemorrhoids, this is the second one. First one is shows the external hemorrhoids. This is external hemorrhoid which you can able to see here. So the picture first one is external, Second one is internal. Third one is interno-external hemorrhoid. Like this, if you take in generally, there are various classification based on the origin. It is a Sahaja and Janma Jatacha. Sahaja is a hereditary, what we were told previously. Janma Jatacha because of the Ahara, Vihara and other things. The based on the dosha, Vata, Pitta, Kapha, Sannipataja, Raktaja and Sahaja. Based on the other characters of bleeding, Ardra Arsha, Shushkarsha, bleeding hemorrhoid, non-bleeding hemorrhoids. On the basis of prognosis, Sadhya, Yapya and Asadhya. On the basis of position, internal hemorrhoid is external, interno-external hemorrhoid, what we have studied. Based on the cause, either it is primary or it is a secondary one, like that. So other than this, which we have shown here with the red, either inflamed condition or a thrombosed one or ulcerated or a prolapsing nature. Apart from all these things, these may be very commonly come across conditions of the hemorrhoids. So based on the prolapse, when the mass is completely lax, grade 1, in case of no prolapse, but prominent blood vessels are seen. In the anatomy we have studied, there is the upper 1/3 portion which is like a velvet like, which is like a dark pink like. Just above that there is a pink. Why it is? Because of the plexus of the vessels, it is appeared like a brownish one. Grade 1 is appearing inside the mass. You can't able to see the mass protruding or the bulge inside the anal canal. Like this, proctoscopy first views this says. Grade 2 is a prolapse upon bearing down but spontaneously reduced. There is a mass inside, it is coming out and going by its own. That is called as a grade 2. Grade 3 is one, there is a prolapsing upon bearing down and requires a manual reduction. Mass is coming out during defecation, but he has to put inside after straining, it has to be reduced like that. Grade 4, the prolapsed and it cannot be manually reduced, which you can able to see in the last diagram. First is the grade 1, second is grade 2, third is the manually reduced, fourth one, even if manually you can't able to reduce it because it is completely out. So these are the different conditions based on the prolapsing nature. There are various theories of the hemorrhoids like varicose veins or a pressure, vascular abnormalities, sliding cushions, and there is a rectal redundancy. It is the rarest condition which we have not seen so far. These were the different theories which explains about the how hemorrhoids are commonly seen in the individuals. What are the important thing is there are various based on the predisposing factors like chronic constipation, chronic straining, prolonged sitting, pregnancy, low fiber diet, portal hypertension, hereditary weakness of the veins. Altogether, these predisposing factors may increase the intra-abdominal and anorectal pressure. Once this intra-abdominal pressure is increased or the anorectal pressure is also increased in turn, that tends to the vessel, puts the pressure on the vessels which is there. It is nothing but a varicosity of the hemorrhoidal plexus. Dilatation and engorgement of the hemorrhoidal venous plexus will be very common. Then it causes the weakening of the vascular wall. The supporting connective tissue will be lost and the downward displacement or the sliding of the anal cushions will be there. And there is a formation of the masses is very common. So, so this is what important is the how the causes etiology will manifest a disease of hemorrhoid. The same thing explained by as a Arsha Samprapti by our acharyas. And after this, how to understand it is the disease is based on the clinical presentations. Foremost important and the first important alarming sign is bleeding per rectum. If any simple discomfort, patient may not come to you. If the bleeding is there, definitely they rush or they run to your clinic. Immediately they ask, sir, this is the problem, what can I do? Bleeding per annum, if it is a purely internal hemorrhoid, as I said, above the dentate line, which is not associated with either fissure or any other disease, very painless bleeding. If it is associated with the fissure, prolapsing or thrombose, definitely it is having with the bleeding per annum. Thrombose mass SF is not having bleeding. If the mass is internally bleeding and externally having thrombosis, that can have a features of pain with the bleeding. The constipation is a foremost important. The patient will be having constipation. He even after 15-20 minutes, he not able to pass. He sits in the toilet and strain. This straining will put some pressure to the rectal mucosa and other things. The vessels will get engorged. The mass is coming. This you can see in the last picture. What you can call is There is a prolapsed mass at 3 internal and external mass it is. Then maybe a patient is having anal itching or irritation may be there. Anal itching because of the unhygienic condition, or there is a mucus discharge definitely causing anal itching. The sensation of incomplete evacuation because of the food habit and the lifestyle, patient is having the mild to moderate constipation, definitely sensation of incomplete evacuation. So he requires a laxative intervention is required here. So these are the important clinical features like bleeding per annum, pain in the anal region, constipation, mass per annum, anal itching or irritation, mucus discharge, sensation of incomplete evacuation. Very commonly we come across. If you neglect these complaints, definitely they take the problem into high level. So how to diagnose this? Diagnosis is purely based on the clinical examination. The triangle of diagnosis, one important is a history. A thorough history is very important in any disease. A clinical examination is foremost important. That's what classically highlighted Nidana Panchaka, Trivida Pariksha, and lastly the local examination. And the triangle is investigation. History taking, examination, and investigation. So first and foremost important proctological examination, proctoscopic examination. Second diagram says the thrombosed hemorrhoid. This is a prolapsing rectum. Third one is the thrombose. Again, it is the interno-external hemorrhoid. Like this, you have to examine. After that, the diagnosis is confirmed by physical examination, general physical examination, systemic examination, and very important is the local examination in relation to this proctological disorders. On inspection, perianal region, either patient in the left lateral or in the lithotomy position, you have to see it. Very commonly is 3-7-11 or the primary hemorrhoidal area where because of the anatomical relation, right anterior and posterior, left is lateral one, that is the 3 o'clock. On inspection, if any mass is there, any ulcer is there, any sinus is there, any external opening is there, any fissure is there, you need to examine there. After that, after the gloved finger with the lubrication in the left lateral or in the lithotomy position, distal rectal examination will be done, and you need to explain the patient what you are doing, how you are doing. You need to explain him and ask him to take deep breathing with the gloved finger, with the lubricated finger. Slowly introduce your finger with the pulp, not with the tip. Slowly introduce, wait for a few seconds, then rotate. Appreciate for 3-7-11, appreciate for any papillae, appreciate for any growth, appreciate for any opening, appreciate for any fecalith or other things by distal examination. Finger is the foremost important finger examination, you can do it. The proctoscopy to visualize the internal hemorrhoids. A flexible sigmoidocolonoscopy can also be done to see the higher level of growth or anything. Rule out the other causes of bleeding, either maybe inflammatory bowel disease or maybe a colorectal cancers are appreciated. Once you examine with the digital examination, you can see here the lithotomy position with the gloved finger, slowly insert and appreciate. Even in the classics, they highlighted lubrication. Gritabhaktam Gudaya Shanai Shanai Pravahamanasya. You need to ask the patient to take deep breathing. You need to slowly, gently enter into the anal canal after only application of lubricant like Grita they are highlighted. So in case of men, you need to appreciate the prostate and other things, or ulcerative colitis, there is a lax mucosa. In case of elderly, there is a lax sphincter. In case of acute condition, the tight sphincter will be appreciated and internal masses can be examined. Then to confirm this, proctoscopic examination is highlighted by Sushruta, Ada Urdhvam Yantra. Yantram Loha. He has highlighted it is to be Gostanakara. If you see the proctoscopy, the parts of proctoscopy are obturator and cannula. The tubular structure is called as cannula. The hard structure which you put inside is called as obturator. With holding like a gun with the lubrication like upward, forward and downward. This is an anatomical position. Slowly you have to introduce into the lithotomy position of the patient with the lubrication. Then you take out the obturator. See in the cannula, interior of the anal canal. First, second, 3. You can able to appreciate the last one is the hemorrhoid. Second one is the hemorrhoid. First one is the early mass. You can able to see. This is what explained by Acharyas also. He says, Gritabhaktam Gudaya Yantram. You need to insert and slowly do it proctoscopic examination. This is one important thing. Hold like a gun. Slowly introduce. upward, forward, and downward, you can see the interior of the anal canal. The same thing can be appreciated here. Anal canal can be visualized internally. What exactly is there, you can see. You can able to see the interior canal up there. This one. So the mucosa, you can appreciate. If the mass is there, you can appreciate the purple color or pinkish color. The purple is because of the vasculature. You can appreciate there is a mass. If it is there, you can appreciate. Once you confirm with the diagnosis with the examination, then go for the differential diagnosis. First and foremost diagram is an external hemorrhoids, the vertic growth like arsha. This is internal hemorrhoids. This is thrombosed, uterine prolapse. The malignancy, you can see here malignancy. The condyloma acuminata, you can see the thrombosed hemorrhoid, the fissure, the rectal prolapse, the pilonidal sinus. Like this, these are the differential conditions which you can come across. Sometimes patients complaining like bleeding per rectum in the constipation. Bleeding may be there in the fissure, bleeding may be there in the internal hemorrhoids, bleeding may be there in the some other conditions of the anorectal region. So based on the bleeding, you cannot say that this is a diagram, this is a diagnosis. You need to go for a thorough examination is very essential. If you won't examine, you will be in confusion. For this diseases, anorectal disorders, unless until you examine thoroughly with the naked eye examination, with the digital rectal examination, with the proctoscopic examination, you will not come to a conclusion or the diagnosis. So the treatment, if you plan, definitely you will be in the problem. Patient is not be getting any satisfaction or the result. So very essential is local examination is essential. So after that, you need to go for investigations. If you are planning for intervention, hemoglobin percentage, blood group, blood sugar estimation, bleeding time and clotting time, blood urea and serum creatinine. If you are planning for intervention, you need to add drugs. So you need to understand the kidney physiology, how it exactly. Then CRP, post-COVID, most of the times we are planning for evaluating the CRP also, C-reactive protein, HbSAg and HIV just to prevent and contagious diseases, a urine routine just to assess the urinary things. If it is a patient of elderly like 50 plus or 40 nearing, because any patient can suffer with any problem and diagnosed like cardiac pathologies. Most of the cases recently, most of the persons who are very youngsters suffering with the cardiac issues. So better go for the physician fitness with the ECG if required to rule out the chest X-ray. If it is required abdominal pathologies, go for ultrasonography. If after thorough evaluation, then the diagnosis is confirmed. Once the diagnosis is confirmed, plan is very easy. Acharya Sushruta has given in the context of Sushruta Chikitsa 6/3, he says 4 modalities of treatment based on the yukti, based on the diagnosis, based on the conditions. That is Chaturvido Varshasham Sadhanopaya, that is Beshaja, Kshara, Agni and Shastra. Why he has given 4 options? Stage-wise treatment can be planned. You cannot implement every treatment in every patient. Patient may be having an alpalinga dosha upadravani beshaja sadhyani. You better go for vatanulomana, agni deepana and sukhavirechaka. Like that, if you do it, definitely the patient will be happy with the dietary advice. If it is a mrudu prasurta avagada uchrita, go for kshara. The same thing he has highlighted in the treatment aspect, like Kshara Karma, Mrudu Prasurta Avagada Uchritani Ksharena. If it is Karkasha Prutu Stira Katina Nagnina. If it is Tanumula Uchritani Kledavanti Shastrina. So he has not given, all should be given at a particular single case. So depending on the condition, depending on the stage, you can plan it. For example, you take a Kshara Karma and Agnikarma. Agnikarma, he has highlighted Karkasha Stira Prutu Katina Nagnina. Why? Because there is no mucosal involvement is there. There is an external component of the hemorrhoid is there. You need not go for a Kshara Karma. If you are going for Kshara Karma, better opt for the where it is an absorption power is more. For example, mucosal area rich vascularity. Once you apply the alkali, there is definitely absorption. Once it is absorbed, the mucosal plexus will be filled with the blood. Blood is nothing but a heme and globe. That is a protein and the iron portion. Once the protein portion is there, it is absorbed and coagulated, necrosis, sloughs out, ulcer and heals like that. So this is a logic where you can plan the Kshara Karma or Agni Karma. If it is an Alpalinga, better go for the Veshaja he has highlighted by Agni Deepana, Vatanulomana, and other things. If it is a too much Krachrita, Tanumula, Uchrita, and Kledavanti like the prolapsed fourth degree, you cannot manage by Agnikarma, you cannot manage by Kshara Karma, you cannot manage by Veshaja, better go for Shastra Karma. He has highlighted. So, what is the conservative management? Dietary modifications is very essential today because we are not having any patients. We don't want which is good for the stomach, which is good for the tongue may not be good for the stomach or belly, which is compromised, definitely leading into the problem. The high fiber diet and adequate fluid intake are very essential for this. The stool softener and the bulk forming agents are very, very essential. The topical applicants for the satisfaction purposes temporarily. There is a hydrocortisone creams are there, analgesics ointments are there, anesthetic ointments are there. Apart from all these things, the most important successful conservative treatment in the initial line is Sij bath. What we can call is Avaga Sveda. A simple lukewarm water Sij bath is applied and advised to the patient. He is getting pain relief, he is getting relaxed, the hygienicity will be maintained, patient will be happy. Apart from all these things, Sij bath is a very essential and important and basic thing for the most of the anorectal conditions. There are various Veshaja Chikitsa, Alpalinga Dosha Upadravani, Veshaja Sadhyani. So Trifala Gugulu, Tridoshara and very essential and very basic thing. Once I start seeing the patient from the day one till now, there is no prescription without Trifala in my prescription. So such a wonderful and a very important drug which you can manage in most of the conditions of the anorectal disorders. If the patient is having discomfort, along with that Pitta Ulbana, like Avipattikara Churna can be implemented. If the patient is having other itching and other conditions like inflamed, better give the combination of Trifala Gugulu and Gandharka Rasayana. If the patient is having Kandu and other bleeding and discomfort, Trifala Gugulu, Gandharka Rasayana and Cheravilvadi Kashaya can be given. If the patient is having the bleeding tendency, better use the Trifala Gugulu, Bolabadda Rasa can be given. If the too much early mass is there protruding out, you can use Trifala Gugulu, Arshognavati or Arshakuta Rasa can be given. If the patient is discomfort very much and heaviness and fullness, incomplete evacuation, Trifala Gugulu, Gandharvastadi Kashaya and Trifala Churna can be given at bedtime or Swadishta Virechana can be given. In this way, you can plan the management based on the Lakshana in the patient. So there are various classifications like Dusparshakadi Kashaya, Gugulu Tiktaka Kashaya, Abhayarishta, Jatyadi Tela application, Panchavalkala Kwata for Sij bath, Trifala Kwata for Sij bath, and Kanshisadi Paila and the Jatyadi Tela can be given. If the mass is too much, you are planning for reduce it, you can use the Kanshisadi local application after the Sij bath. Or you can give the Kanshisadi Matra Basti or Jate Tela Matra Basti. If the very much discomfort is there, Jatyadi. If the very much bulge mass is, go for the Kanshisadi Taila. In this way, if you plan the combination and permutation of the different things, you can definitely get success in that. In non-surgical procedures, rubber band ligation is the oldest technique which was practiced earlier. I don't think we are practicing. Very hardly the results are there. There is important things, sclerotherapy, injection, sclerosants are given. This is also one of our PG scholar, Dr. Srey Patil, who is from Gujarat, who studied comparative study of the sclerotherapy and the Kshara Karma, whereas most of the complications come across by this sclerotherapy also. The infrared coagulation is one thing, rarely it is practiced. The next important thing is surgical procedures like hemorrhoidectomy or stapled hemorrhoidectomy. If you take the regularly hemorrhoidectomy, which you can come across, there are two important techniques. One is a closed or open. Based on the degree, like 3rd and 4th degrees are indicated for this. Closed hemorrhoidectomy technique is also called as a Ferguson method, or open hemorrhoidectomy is called as a Milligan-Morgan technique, which commonly routinely practiced in the allopathy side. Even most of the Ayurvedic surgeons are opting for this also. Stapled hemorrhoidectomy, it is also indicated in the same thing, but it is a very costlier affair. So we don't have any kind of exposure of this one. So being an Ayurvedic graduate and being an Ayurvedic teacher, I suggest most of the parasurgical procedure still stands first in the management of most of the proctological conditions. The parasurgical procedures are performed by using non-surgical tools or without surgical instrument, what Sushruta says. Acharya Sushruta has described 60 Upakrama, 25 Upayantra and 14 Anushastra. In that, Agnikarma, Kshara Karma or Kshara Sutra and Raktamokshanas are wide in use in different conditions of the Arsha or parasurgical procedures in case of Gudagata Vikaras. Indications for parasurgical procedure, if you see in Kshara Karma, Agnikarma and Raktamokshana, he says Kshara Karma Bagandhara Arsha Nadirona, Agnikarma Arsha Bagandhara Nadirona, and Raktamokshana Arsha Vidradin. In these conditions, you can definitely plan and you can definitely succeed in managing the cases with reference of the Acharyas in Brahatrayis, and we can successfully manage these cases. Kshara Karma, Shastranu Shastrebhya Ksharaha Pradhanatama, he says. Why it is Pradhana? Chedya Bedya Lekka Karana. It does all the procedures, even the instrument scalpel also. What scalpel does, it definitely does that procedure. Agnikarma, Kshara Dagnir Gariyan Kriyasu Yakyatama. If both the compared, better is, I told in the beginning, depending on the condition, depending on the situation, you can plan it. Lastly, the Raktamokshana, where I was highlighted about thrombosed hemorrhoids. If it is a case of thrombosed hemorrhoid, what is thrombosed hemorrhoid? There is a collection of clot in the external component of the skin at the peripheral region in the anal verge. That is externally, you can able to see thrombosis, the clot is there. This clot can be taken out by giving the incision or the nick with a blade, or else even the simplest way of parasurgical procedures like Jalouka, if you apply, being the herodine and the anesthetic agent in the dentures of that leech, which will directly liquefy the blood and it sucks out, and the mass will be reduced, the pain will also be reduced. So the indication of parasurgical procedures in different proctological conditions I highlighted. If you plan any procedure, very essential to divide into a Purva, Pradhana and Paschat. In Purva Karma, better after diagnosis, take the physician fitness, take the informed consent for the documentation purpose, prepare the part for the proper maintenance and avoid the infections and other things. Soap water enema, because clear the bowel, so for it can create an ease in the procedure. Tetanus toxide 0.5 ml IM is very essential, what we routinely practice. And Xylocaine test dose 2% intradermally 0.2 cc is given for every case prior to taking for the surgical intervention. The required instruments are collected. These are the instrument trolley where you can bowel with the betadine, with the Jatayathaila, sponge holder, needle, syringe, proctoscopy, blades, Alice forceps, artery forceps, gauze, pad. These are the instruments which required during the procedure. There is a Pradhana Karma. Once you diagnose the taken patient in the lithotomy position, and the part was painted with the betadine solution and the spirit, and the part is draped with the sterile towel. Xylocaine in 2% was infiltrated with adrenaline or without adrenal plane, can be taken depending on the condition. So rhomboidal fashion, the injection is given. The manual anal dilatation with the lubrication, slowly starting with the one finger up to the forefinger can be done. Proctoscopic examination was reconfirmed by the confirmation of the position of the masses. The pile mass held by using the pile holding forceps, and the mass was transfixed at the base by using the curved round body needle with the Kshara Sutra. Then the pile mass was ligated anteriorly and posteriorly with adequate knots to secure it to arrest the bleeding. Complete hemostasis was achieved and the pack is done. Then the patient is shifted once the procedure is complete as a Pradhana Karma. This is a Kshara Karma, Abhyantara Arsha procedure, application of Kshara. There is a protrusion of the masses here. You can slit proctoscope. Kshara is applying. After that, Shatamatra Kala, the Pakwa Jambu Varna, you can appreciate here. After healing, you can take after the treatment, you can see here. This is Kshara Karma. Paschat Karma, anal pack followed by bandaging, treatment followed as per the schedule. The most important thing what to be assessed post-operatively is the pain. What type of, only due to the handling pain is there, Kshara Sutra pain is there, you can manage it better. If it is an excruciating pain, if it is associated with the fever, definitely suspect for any infection, then you have to handle it properly. Post-operative bleeding, it should not occur. either ligation or Kshara Karma, don't expect the bleeding. If it is a bleeding, definitely you have missed. Wherever bite you have taken, just leaving that you have ligated it. So beyond that, there is a chance of bleeding is there. And you need to assess the sphincter tone. Should not damage during the procedure. You need to appreciate it. These are the very essential assessments post-operatively. The mode of action of the Kshara is which coagulate protein in the hemorrhoidal plexus. The blackish discoloration will appear as a pakwa jambu phala. How it acts, it is by chemical cauterization of the pile mass, which helps in controlling the bleeding. Once you apply, the shrinkage of the hemorrhoidal mass is taking place. The caustic action will help to reduce the size of the mass. The necrosis of the tissue with the obliteration, it sloughs out within the 5 to 7 days. Then it leads into the fibrosis and there is a scar formation. The complete wound healing within 10 to 15 days will be there in case of Kshara Karma. The Kshara Sutra Vidhi, what he says, Vandanat Sadruda Sutram Chindya Tarshaha Bagandara. In the context of Chakradatta, he says, how to prepare. Bhavitam Rajani Churnam Snuhi Kshire Punapunam. By taking the barber thread number 20, once you apply the Snuhi Kshira, after that you need to apply Kshara, then you need to apply the Haridra. Like this 3-7-11, what is told in the classics, but routinely it is not continued 3-7-11. Lesser than that we are taking. If you take that one, the thickness will be more, potency will be more, it cannot tolerate it by the patient. So routinely it is not that much coatings are taken what we are practicing presently. This is a Kshara Sutra procedure. Initially the mass is, you can appreciate 11 o'clock mass. Then with the sponge holding forceps, you have to hold it. Prior to that, the mass is there. Then the local anesthesia is given. Then the mass is held with the sponge holding forceps. With the Kshara Sutra, which is seen in the gauze packed in the tube, it is applied here. After the 7th day, the masses will be fallen and collected like this slough. It sloughs out with the thread. You can appreciate. This is a Kshara Sutra ligation technique. This is a complete healing, another case. This you can able to see how the Kshara Sutra is done. There is a video. Local anesthesia after painting and draping in a lithotomy position. Local anesthesia is infiltrated with adrenaline, or you can apply plain. So with the lubrication, slowly 1 finger, 2 finger, slowly you need to relax the sphincter muscles. Held the mass with the Alice forceps and with the sponge holder. Transfixation, a needle loaded with the Kshara Sutra is transfixed. It is tied on either side. For externally, you need to create a V-shaped cut so that it will strangulate better. You need to confirm it. Like this, you have to manage. The mode of action is the Kshara Sutra is prepared. There was a sorry for the disturbance. Initially, I shown Kshara Karma and other things, and then the Kshara Sutra. There was a slide variation was there. The transfixation and pressure effect is there. The Kshara Sutra is passed through the base of the hemorrhoidal mass, exerting the mechanical strangulation of the mass. Mass is nothing but is a varicosity of the hemorrhoidal plexus. This arrests the bleeding, compresses the mass, decreases the swelling, and leads into the ischemic necrosis of the tissue. There is a chemical cauterization will happen in that one, which is with the Apamarga Kshara Sutra, what we have used. This results in protein denaturation and tissue cauterization, shrinkage of the mass, and gradual dissolution of the hemorrhoidal tissue, which you have appreciated with the thread. Strangulation and necrosis is very commonly appreciated here, which by using this, which you can prevent the recurrence of the prolapse and promotes the permanent resolution of the mass, and the patient will be happy within 10 to 12 days. It is also having the anti-inflammatory action, healing by regeneration and scar formation and stability. The herbal component is important for soothing the anti-inflammatory effect on that particular tissue, which alleviate the pain and burning and swelling. The therapy encourages gentle debridement of the unhealthy tissue with sloughing, usually within 5 to 7 days, which stimulates the healthy granulation tissue after taking out, which ensures the wound closure with the minimal fibrosis. The mild caustic action induces the firm scar tissue formation, strengthening the anorectal wall and which prevents the future prolapse, which cannot be seen. There is no recurrence for many years which I am practicing. I never come across any masses which any case which recurred in the same position which we have operated. There is a wrong information from the patient which is passed in the society that once you have gone and underwent a procedure, it may also come. When we have planned for the procedure, he might have suffered with only one mass, which you have seen 11 internal external. But the tendency of getting the prolapsing because of the constipation and other things, other areas like 3, 7, 11 like also possible. Due to that reason, they say there is a recurrence. Once you operate, I never come across in my 20 years the recurrence of that operated masses. This is another one external hemorrhoid which is managed with the Agnikarma in case of Arsha. It is a Karkasha, Protu, Stira, Katinan, Agnina. A red hot Salaka or a thermal cautery which is used to cut which does the both cutting and coagulation of that one. So by this way, you can plan the management. Video then. It is with the proctoscope, which there is a hypertrophic papillae which is there inside. We are trying to burn it out because if the hypertrophic papillae is remained as it is, in the etiology we have mentioned there is a aghata injury because of the hard stool. If the hypertrophic papilla gets injured, it gets infected. Once it gets infected, there is an abscess formation will be there. Once the abscess formation is there, that is in future develops into a fistula in So to overcome that one, once you take out the external hemorrhoidal masses or skin tags, along with that, with the proctoscopy, you have to visualize and you have to confirm and you have to take out the hypertrophic papilla to burn out. So that this is very essential to do the cauterization or the Agnikarma for the hypertrophic papillae. This is what external hemorrhoid. क्या हुआ? Stay there. So by using the Shalaka, it does the hemostasis as well as the cutting also. Agnikarma is an Anushastra Karma, the parasurgical procedure, elaborately described by Sushruta Samhita in Sutrasthana also. Agnikarma is a best procedure and is very easy to perform. Once treated, this will not recur in any way. That is, he said, that is Sadhyanam Samyak Dagdanam Apunarbhavam. If the indicated diseases, if you are planning for the proper procedure, there will not be any recurrence. If the non-indicated diseases, if you are not doing it properly, definitely there is a recurrence is there. So Agnikarma stands first in case of in these conditions. It is performed by various materials which are treated, termed as the Dahana Upakaranas explained by Sushruta in different metals. The last one important is Jalau-Kavacharana in thrombosed hemorrhoids. Once it is the thrombosis is there, already I told, there is a patient says the history of the doctor, I was all right 3 days before. Yesterday I traveled from Bombay to Hubli or Hubli to Bombay or somewhere I am taking example by sitting in a bus. Next morning I got a swelling. Third day I am unable to walk and sit like that. He comes to us. Fourth day when he come to us, we examine, there is a firm tendency, consistency. That is when you appreciate your tip of nose, the same appreciation is consistency of the swelling at the perianal region, which definitely indicates the thrombosis of the mass. Once there is a thrombosis, either you can use a scalpel and take out the evacuation of the clot, or else a simple parasurgical procedure like Jalauka, if you apply, it dissolution of the mass and it sucks out the whole the blood, the patient will be happy. Or else, this is what the Bhartada procedure. So you can appreciate, it sucks. There is a sucking of blood by the Jalauka in the perineal region. The thrombosis when occurs in a perineal masses. The same thing, anticoagulation and the pain relief by this leech. It is widely used. It is one of the important parasurgical procedures to reduce the pain, to prevent the further clotting, and it is very important by anesthetic. And Hirudin is one important thrombolytic which is commonly used in case of thrombosed hemorrhoids. Thrombosed hemorrhoid can also be taken out by using the scalpel. This is one example. This is a thrombosis. Second one, after giving the nick, we have taken out. This is a clot. This is the post-operatively. Once with this blade we are taking out, there is an Agnikarma or hemostasis is essential in these conditions. These are the diagrams which highlights about the thrombosed hemorrhoids. This is thrombosis procedure. Reverse ಆಗಿದೆ ಉಲ್ಟಾ ಆಗಿದೆ there is a taking out by nick. There is a video is reverse, sorry for that. Evacuation of thrombosed clot. So this is what clot is evacuated. Now it is clear. So like this, the clot is taken out. The last picture is completely healed like this, and it will take 5 to 10 days to heal. So Sthanika Chikitsa, among all these things, what is highlighted is Pichu, Lepa or Avagaha Seda. That is either Ushnodaka or Trifala or Panchavalkala, or even patient is having some pruritus ani or fungal disorders. You can add into that Ushno Jala. There is a Gomutra also can be used. Post-operative care, the pain management with the NSAIDs or local anesthetics, laxatives to prevent the constipation, Sich bath to prevent pain and maintain hygiene. There are various complications which we come across in the hemorrhoids. There is a profuse bleeding if you are improperly managed. There is a strangulation. There is if you are not maintaining the aseptic precaution taking, there is an infection. There is a thrombosis even after the post-operative cases. There is a gangrene. The most dangerous is foreigner's gangrene is very commonly come across, but rare one. The fibrosis or fibrosis can occur. There is a portal pyemia or ulceration can occur. If you are taking out extreme skin, external area, if you burn, you cut, definitely the anal stenosis will be there. If you are not doing sadhyanam samyak dagdanam, this is a common rule for any indicated any procedure. If you are not doing procedure in indicated diseases, if you are not doing properly the procedures, every chance of recurrence. So I have put it the last one. So it is very essential to post the patient for indicated patient, plan the procedure properly, methodically with the stepwise, so there will not be any recurrence or any infection or any other complication you may come across. There are various recent advances in the treatment of hemorrhoid like laser hemorrhoidoplasty or radiofrequency ablation or finger-guided hemorrhoidal artery ligation, FGHAL, or cryotherapy, or DGHAL, Doppler-guided hemorrhoidal artery ligation. These were some recent advances which are practiced widely in outside. Very important thing is prevention is better than cure. So how to prevent? Prevention is better than cure. How to prevent is you need to avoid Sankshepata Kriya Yoga, Nidana Parivarjanam. That is most important thing. Avoid exciting factors, improve the bowel habits, advise the anal exercise, advise yogasanas, which is most important is yogasana, sarvangasana is a very important thing which we commonly practice. There are Ashwini Mudra. These are the other things which you can do's and don'ts. High fluid intake, high fiber rich diet, timely intake of food, good personal habits like avoid smoking and other things, alcohol, unhealthy food habits, long sitting, straining during defecation, bad habits, all these things if you plan definitely will. So most important, the glimpses of this is apatya. Avoid this Vega Dharana, Vegodhirana, Ati Vyavaya, Ati Vyayama, Utkutasana, Diva Swapna, and complications by Panchakarma, Ati or Ayoga. Anal exercise, every organ requires an exercise to maintain the healthy status. The same thing, Guda also. There is one procedure called as Ganesha Kriya. The lubricated index finger is introduced into the anal canal and it is moved clockwise or anti-clockwise. So that sphincter muscle relaxation will be there. A proper circulation is maintained and there will not be any problem. So improve the bowel habits by regularly in defecation, maintaining the regularity in defecation, avoid unnecessary straining during defecation, maintain the local hygiene. Lifestyle modification is very essential. Avoid working for longer duration or sitting or standing. Avoid traveling long distance at a stretch. Avoid alcohol. Avoid tobacco either in the form of gutka or cigarette. Avoid exciting factors like excessive consumption of tikshna, ushna, vidahi, ahara, langana, ati gurubhojana, exposure to too hot and too cold conditions. These are the very important thing. There were very important thing information what I told in November 20th. I wrote a article on piles a burning issue of the world. On the English article, on Kannada article. When to refer the cases? If the persistent rectal bleeding is there, generally in case of this is reference from general practitioner to the specialist, I am telling. If the persistent rectal bleeding, better refer. If the dark tarry stool is there, there is a high level problem. If the severe pain, swelling in the anal area, if difficulty in passing stool with an extreme discomfort, with the mucus or pus discharge with the fever, with the family history of colorectal cancer, a thrombosed, inflamed or collapsed masses, better refer. Which is indicated for intervention, better refer. Lump or mass at that does not reduce, better refer. Change in the bowel habit. Patient is having constipation, diarrhea. Definitely it is a sign of malignancy or other higher level problem. Better refer such cases to the specialist before, otherwise it is causing problem. So very important how to reach success, how to get a success in this is every treatment has got a limitation. Don't think that everything can be managed. Don't say like that. Don't practice that. You think of complications, then plan. There is every chance of recurrence if you are not managing properly. That's what I said, sadhyanam samyak daddhanam. It definitely affects the quality of life. If you are giving result, you will become a god in their life. They will treat as a second god you. So these are all things considered. If you consider all these things, plan the management, definitely you will reach the height and you will get the credentials from the patient and you will get the blessings also along with the money. The conclusion is hemorrhoids are the common yet manageable conditions. Diagnosis based on the clinical features and examinations. Management ranges from conservative to the surgical. Minimally invasive techniques offer the better outcomes. So parasurgical procedures I have highlighted. Proper post-operative care reduces the recurrence. Ayurveda classics have proven to be efficient in preventing and managing the ARSHA with the various treatment modalities like conservative, parasurgical as well as surgical options available based on the clinical presentation with the minimal cost and the minimal hospital stay, a day care procedure. Rectal examination is very essential for any patient with anorectal or bowel symptoms, my dear friends. If you don't put your finger today, you might put your foot in it later. This is a case of cancer, advanced cancer with an ulceration. Patient is with me. He came with an hemorrhoid, but diagnosed as a CA rectum after biopsy. Because of the negligency, because of the folklore management, patient suffered and he is with the other treatment. So it is very essential. If you don't put your finger today, you might put your foot in it tomorrow. So take home message is not all anorectal conditions are hemorrhoids unless until diagnosed. Stage-wise understanding is the key to success. Superstitions like wearing ring, tying thread, burning with the red hot metal, these are all the folklore what they practice this to be educated properly. Proper diet and bowel regulation can prevent the forthcoming problems, my dear friends. So it is very essential. Thank you very much. I think whatever I had an idea of presenting proctological cases, along with that, first and foremost important hemorrhoid, I think I have completed. Thank you very much. And Dr. Nijam and Dr. Megha and all the audience, thank you very much for patient listening. If you have any queries, most welcome. Dr. Nijam, doctor.
Yes, sir. Now one announcement for audience. Dr. Dipali share the PPT.
Hello,
Ah,
Namaste, sir.
namaste, namaste.
Uh, Sorry, sir, I have a doubt about Fistula, sir.
Uh,
Sir,
can you, doctor, can you wait for a few minutes? We'll share some announcement and then we'll interact for the question answer session.
sure, sir. Thank you, sir.
Help us. And it is very important thing. Every 3 year, we are conducting a event. That is the most important thing is we designed is Shalya, Shalakya, Prasuti, Panchakarma. All these things are procedure related departments. By these procedures, we can explore the skills, hidden skills in the individuals. So 3 year back, we planned Kaushalya Bharati 1 in the Hubli itself. 2 days workshop, live demonstrations were there on the stage by considering the resource persons various parts of India. The same thing this year, it is a host college is Gavisiddeshwar Ayurvedic College Koppal, but the organizers are Kaushalya Bharati, the team of Kaushalya. This year, this time it is an international seminar with the 17 resource persons, 4 persons from abroad, and other person, 4 persons from the in-state, and other person from the outside the state. This seminar will be there on the 10th, 11th of October this year at Koppal. The keynote speaker will be renowned teacher, emeritus professor, director of SDM institutions of group of institutions of Ayurveda, and my revered guru, Dr. Prasanna Narasimha Rao sir, and all the renowned teachers and youngsters are there, and they will be highlighting and exploring their skills. I request you all to avail the benefit of this Kaushalya Bharati 2 at Koppal, and along with other things, important thing like the Kuti Praveshika Rasayana, the technological innovations in the field of research, and the patency, how to get the patency. And there is a very important thing is a person from Bangalore, Dr. Ashwath Rao, the MS, MCH surgeon, who will be dealing about on Ayurvedic oncology, and he will be exploring. Like this, all the 17 resource person will be highlighting and exploring their skills, person from abroad and outside the state and inside the state. And our Kaushalya Bharati team is doing sincere effort to explore the skills, hidden skills. And I request you all to participate, present your paper, avail the benefit, and help us. Thank you, Nizam, for this opportunity for announcement of this Kaushalya Bharati this year with the Gavidipti, because it is held in the Gavisiddeshwar Ayurvedic College, so the Gavidipti title is given, but the organizers are Kaushalya Bharati team of Karnataka. Thank you very much. Now it is open for, I think, a question answer session. After the Dr. Nizam, any opinion?
Yes, sir. Anyone will
Yeah.
ask a question? Sir, one question here. Sir, in thrombosis, hemorrhoid, Acharya Sushrut has said about Jaloka, but sir, we got the Mercedes sign. How can do the post operative?
Dr. Nizam, doctor?
Yes, sir. Now I am introducing Dr. Shivanan for vote of thanks.
Respected dignitaries, esteemed guest speaker, and dear participants, a very good evening to one and all. I am Dr. Shivanand, host behind the viral Instagram page, Just GM Sittings. On behalf of Ayurveda, Ayush Gurukulam and Zenith Ayurveda, it is my proud privilege to propose the vote of thanks for today's enlightening webinar on an approach to anorectal disorders through parasurgical procedures. First and foremost, I extend my heartfelt gratitude to our esteemed speaker, Dr. S. A. Patil sir, Professor, Department of Shalyatantra, uh, Ayurveda Mahavidyalaya Hubbari, and Chairman of Board of Studies, PG Ayurveda at RGUHS, Bangalore. Sir, your deep insights, clinical experiences, and clear explanations have truly enriched our understanding of the subject. We are grateful for the time and efforts you have taken to guide us today. I also extend my sincere thanks to organizers Ayush Gurukulam, Zenith Ayurveda, and Dr. Syed Nizam and the team for their vision and commitment in bringing such valuable academic sessions for the Ayurvedic fraternity. I also thank the co-founder of the Ayush Gurukulam, Dr. Kalpesh, for ensuring the smooth conduct of the webinar. A special note of appreciation goes to the participants who joined us this evening. Your presence and active engagement have made this session lively and meaningful. We also acknowledge our digital partners who have been the true backbone of this event. Your support helps the Ayurveda reach thousands of learners and practitioners worldwide. We encourage everyone to follow and support them because together we can amplify the voice of Ayurveda. Our digital supporters are Innovative Ayurveda, Ayur Suraksha, Ayurveda Media, Kashyapa Ayurveda, Allo Ayurveda, AMV Hubli, Just JM Sittings, DMIU Kingdom, DMS Medicos, Professional Vaidya, Half Doctors, Apte Ayurveda, Prona Ayurveda, Ayu Nirvana, BMS Vaidya, BMS Ayurveda Vijnana, Rishi Satyavaha, Avishkara Ayurveda, Ayurveda Darpana, BMS Ayurveda, BMS Gallery, BMS Influencer Hub, Ayurshala, BMS Kata, Agastya AMV, Sai Pratham Neurocare, BMS Doctor, BMS Loka, BMS Ayurveda Official, BMS Vaidya, Mahaushada, Next Toppers, BMS Ayurveda Vijnana, and Ayurveda Tech. Thank you all for your incredible contribution to this mission. As we conclude, let us carry forward the learnings from today's session and continue working towards our mission, Ayurveda for all. Thank you, Anand.
Thank you, Dr. Shivananda. Thank you. Mhm.
Sir, now session
Uh,
is open for
Sir, one more question is there in chat box.
Yeah, yeah. Yes. There in
Firstly,
thrombus hemorrhoids, Acharya Sushruta has said about Jalavka, but sir, we get the. What's her name?
Hello, namaste, sir.
Just a minute, sir. Yeah, please, sir.
Sir, while doing the Kshara Sutra in Bagandhara treatment, sir,
Yeah.
we usually advise the sits bath, sir. But what I think is it advisable to take sits bath because the coatings may wane off in the sits bath, right, sir? What I've seen after 2 days, if I like just pull out the Kshara Sutra, sir, there will be no coating of Kshara only, sir. Do you recommend, sir, sits bath on the from the day of Kshara Sutra ligation, sir?
Yeah, doctor. Doctor, first of all, whatever the methodical way of preparation of Kshara Sutra, if it is not followed properly, so this is the case. Otherwise, it is not like that. If you are doing it properly, regularly coating, drying, it will not peel off by simple siege bath. Siege bath is advised because it is maintaining the reducing the helps to drain out the collected things by rectal contraction and relaxation. So whatever content is there in the tract will be drained and hygiene is maintained and pain is reduced. So if it is properly prepared Kshara Sutra, we will not come across this problem. This is the answer.
Thank you, sir. Thank you so
Okay.
much.
Okay. And one more question. In thrombosis hemorrhoid, Dakshina, what is that? Sir, we get the maceration sign. How can we do the post-operative?
Daksha, you can directly ask.
Okay, thank you. Good evening, sir.
Yeah, please, madam.
सर एक्चुअली जैसे आपने बताया कि जलों का यूज़ करने के लिए बोला गया है। लेकिन सर कभी-कभी ऐसा भी होता है ना कि हमें जैसे हम अगर फेस पे लगाते हैं या वैसे तो हमें मर्सिडीज साइन मिलता है जब हम जलोका से करते हैं मतलब ट्रीटमेंट।
Yeah.
उसका वहाँ पे मार्क रह जाता है ना सर, फिर हम उसका ऐसे हम वैसे करते हैं मतलब हम उसके बाद उसका पोस्ट ऑप हम कैसे करेंगे?
Yeah. As usual, the anorectal post-operative pain management, hemostasis, and the siege bath, all these things are advised. Ultimate aim is after the Jalavakavacharana, the whatever amount of clot is there, it is taken out. And it is a painless by the Jalavaka itself, and it is the liquefied, whatever clot is collected, that only will come out. Once it is come out, you need to put a pack. Next day onwards, you can advise them to go for the siege bath. If you advise with the same day siege bath, it is a painless, oh, no problem. It will reduce the pain, but there is every chance of getting bleeding. So you need to put a pack and send, and next day onwards, you can advise for the siege bath. Okay?
Sir, one question
Okay,
on
sir.
this.
Yeah.
Dr. Pratik asked, sir, can you please
Yeah.
share view of cryotherapy in hemorrhoids?
Yeah. Which one, sir? Kshara Karma?
Cryotherapy in hemorrhoids.
I am not getting what you are asking, doctor.
Uh,
Cryotherapy.
Cryotherapy. Acha, yeah. Cryotherapy, which we are not practicing, that's what I told. There are various treatment modalities are highlighted. We are practicing exclusively these parasurgical procedures. The procedure, it is practiced widely in the outside, but I am not doing that practice. I am doing most of the success, so I am doing this one. I wanted to highlight about what is told in our classics. I want to explore that, so I am doing this practice. Got, doctor?
yes, sir. Namaste, sir.
Namaste.
Sir, how do you tackle the high anal fistulas or grade 4 fistulas, sir, like supralevator extensions and this so another one, sir, supralevator and extrasphincteric fistula with Kshara Sutra, sir. Do you
Yes.
you will put the whole track with Kshara Sutra or just open in the 6 o'clock, sir? Please explain about that, sir. Thank
There
you.
are various methods are highlighted. I think this is a session for Arsha and other things. If Dr. Nizam is giving one more chance for us to present that elaborately, so that I can able to show detail about the fistula and the different treatment modalities of the fistula, I think that is right, doctor.
Okay, sir. Okay, thank you, sir.
Sure, sir, sure.
If you don't mind,
Happy to give
because
more
it is not only an, within a.
Thank you so much, and thank you all audience.
Any other doubts? Please ask.
Why Kshara Karma is contraindicated in external hemorrhoids?
Yeah. That's what I told. Because Acharya has clearly clarified that Veshaja, Shastra, Kshara, Agni. So even if you apply for external hemorrhoid, it is a skin covered. The absorption rate of Kshara will not be that much. As it is a Bhaya, Karkasha, Stiru, Prutu, Katinan, Agnina. He himself has told that Bhayarsha are best indicated for Agnikarma. So Kshara Karma is, you don't go for Kshara Karma. This is the answer for that. Any other?
Sir, when the internal hemorrhoid is prolapsed, sir, let's take in third degree hemorrhoid, sir, grade 3 hemorrhoids. So in that case, can we apply Kshara Karma, sir?
Because it is a completely prolapsing out, even if you apply 1 or 2 sittings of Kshara Karma, that may not sufficient to completely reduce it and coagulate it. So that is the best option for late third degrees or best option for Kshara Sutra rather than Kshara Karma, I suggest.
Okay, sir. Thank you, sir.
Priyanka Shastri, is it safe to use lignocaine with adrenaline for local anesthesia for? Yeah, definitely. That's what I told. If the conditions are not favoring, the patients are having some cardiac issues and other things, better use the plain Zalekin instead of with adrenaline. But routinely we use adrenaline only, with adrenaline, with the test dose, with the confirmation of the other things. That's what I told. If the patient is having some other systemic pathology like diabetes, hypertension, other diseases, better take consent or opinion of the physician. Protocol has to be followed. Present days are not so easy as earlier days was there, because anything is to be they are asking for records. So if you have a document legal bindings, that is very essential to practice. Please, then sir, in this thrombosis, I
Sir,
think Nizam
last
doctor,
doubt,
I
sir.
think any question? Yeah, please.
Sir, last doubt, sir.
Yes, sir.
Sir, what are the chances of anus stenosis or anus strictures in case of Kshara Karma, sir? Because I have in our hospital, sir, some patients have come after taking this Kshara Karma treatment, sir. So there was strictures, sir. Actually, what are the possibilities of strictures, sir, after Kshara Karma?
Yeah, sir. Once you introduce a proctoscopy of slit proctoscopy, you need to cover other than the mass area. You
Yes,
need to
sir.
cover with a gauze, wet gauze or a wet swab. Only the protruding mass, which is the hemorrhoidal mass, that only you need to apply the Kshara Karma. If you are applying beyond that, even in the normal tissue, definitely it is causing the stricture. So to overcome that, that's what I told. Sadhyanam, Samyak Dagdanam, this is a cross reference for all procedures. Indicated disease, properly doing the procedure will not lead into a complications. You will be very successfully do it with a methodical way, with a stepwise way, so that you need to insert a proctoscope, cover all the normal tissue, only expose the pathological part. That you need to apply Kshara Karma. Then there will not be any chance of stenosis or stricture. With my last 20 years plus, I am doing all these things. I never come across single case, because we are taking utmost care to manage the cases.
Sir, at a time, only one mass is, sir, in one setting, sir. When we posted the patients for OT, sir, if he's having 2 or 3 internal hemorrhoids, sir, we can apply the 3 at a time or one setting after, like that. How many gaps should be there, sir, if you want to give the gap between 2 settings, sir?
Definitely you can apply, doctor. Definitely you can apply. Only thing, the pain component will be more. You need to manage the patient pain management, and you need to counsel him and thoroughly do the post-operative care, and proper follow-up and advice is to be taken care. Yeah, definitely.
Sir, and with the external components, sir, where we'll be having with some cases, sir.
Yeah.
In that case also, we can do this Kshara Karma, right, sir?
Kshara Karma is for internal. For external, use a cautery and take it out.
Yes, sir. Right, sir. Thank you, sir. Thank you so
Yes,
much,
sir.
sir.
Any other doubts?
No, sir.
No doubts? Okay.
Thank you so much, sir.
Thank you, Dr. Nizam and Ayush Gurukulam and Zenith Ayurveda and all the Dr. Shivanand and Dr. Megha and all other members and respected audience.